Hey, everybody. Welcome to 7 Minute Health Chat with Robin and Kim. There is a reason that we are both dressed pretty in pink today. And that reason is, you guessed it is Breast Cancer Awareness Month this month. So we wanted to hit this topic right out of the chute, first Wednesday of the month. And so I'm going to talk to you about how to know what the signs of cancer are as soon as I put my glasses on. So here are some signs, guys. And listen, if people get squeamish, close your ears right now because there's a couple little squeamish things on here that I'm going to say. So sorry. So signs are lump in the breast or underarm, thickening or swelling of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area of the breast.
Hopefully no kids are
Pulling,
listening.
I know, close your kids here. Pulling in of the nipple area, nipple discharge, including blood.
Mm.
Any change of size or shape of the breast, pain in the breast. And just as a side note, not all of these things mean it's cancer, right? But that is why you should have your yearly mammogram and you should have your monthly breast self-examinations, right? So don't miss those either and watch for different signs like that. Even though they say that most breast cancer starts after the age of 50, there are still a lot of younger cases as well. And I know Kim knows some, and I do too. And I'm sure you do too. I know that all of us have been in touch with breast cancer somehow, either with a friend or a family member. So we just kind of want to put this stuff out here just to reinforce it in this month. So what I want to tell you also are things that you can do to combat breast cancer and to keep it away from your body as best you can. And that is keeping a healthy body weight, exercising daily. And that doesn't mean you have to kill yourself, right? That means taking a walk for 20 to 30 minutes a day, if that feels good, or going swimming, walk your dog, just get off of your sofa, right? Don't live a sedentary life. And then limit your alcohol consumption, and limit postmenopausal hormone therapy. And then for the younger people, breastfeeding is very helpful also, to lower your risk. So that's my little intake or input on this. And so Kim's going to give you her input.
Yeah, and eating a healthy diet, obviously a diet that is free of processed foods, focusing on whole foods, that's really very important. But I want to share the three kind of top foods that have been shown to help fight cancer, beat cancer. And I want to show you, I would recommend this book for everybody. I know I've shared it before, Eat to Beat Disease by Dr. William Li. He talks about so much in here about what to eat, fighting different cancers and stuff. So I'm going to talk about three foods that are specifically geared to, actually studies have shown they fight breast cancer. So number one, and this has kind of been controversial in the past, but it's soy. So soy, they were saying before that, it has phytoestrogens in it. Those are like estrogens, extra estrogens in the soy that were contributing to breast cancer. Well, now they found out that actually they're protective. And so, but you want to have soy in more of its purest form. That's like soybeans, like edamame, tofu, tempeh, natto. I mean, there's so many different soy, well, not so many, but these are more like the more common soy products that you can eat that are healthy, minimally processed. Also soy milk. And I actually just recently switched to soy milk from almond milk because I wanted more protein in my milk. And actually I love the taste better. It's a great taste. And I get organic, unsweetened, no sugar added, minimally processed soy milk. It's got 7 grams of protein, which I want. And the interesting thing about that he talked about that soy is so beneficial in human studies. And the ideal amount of soy each that you want to have daily, soy protein, is 10 grams a day. And so I'm getting that almost with my 1 cup of soy milk. And so I want to read this quote. I thought this was really great. This was in his book. It said, soy can starve your cancer and feed your health. So turn your mind around, shift. It's a mind shift about what you previously thought about soy. Now, the soy you want to avoid are processed foods that say, oh, it's got soy in here. Or like those Impossible burgers. They're impossibly unhealthy.
Or the bars, like
Yeah.
the protein bars that say, soy lecithin or whatever that is in there.
But
Yeah,
yeah.
yeah,
You
we don't
wanna-
want that.
You want to avoid highly processed soy. It loses its nutritional value. And so, like a lot of things do when they're highly processed. So
Right.
soy is our friend, taken in the right way. Number 2, extra virgin olive oil. I've talked about this before. Extra virgin olive oil has so many phytonutrients in it. Yeah, it dramatically was shown to reduce the growth of cancer cells, breast cancer cells. So don't be afraid. Make sure it's extra virgin olive oil, ideally organic extra virgin olive oil. So protective. So don't be afraid of that. I eat a higher fat diet, and that's one of my go-tos that I do almost daily. And then broccoli. Broccoli is like a powerhouse cruciferous vegetable. We should be eating a lot of cruciferous vegetables anyway, because that helps to eliminate estrogens, excess estrogen out of our body. But broccoli was shown to decrease levels of a type of estrogen that was linked to breast cancer. And in the reverse, it increased the right amount of the right estrogen type that helped to protect against breast cancer. So it did two things, which was pretty cool. Those are the top 3 foods. There are other great foods, but these are have been shown in cancer studies, breast cancer studies. So if you've not heard of intermittent fasting, there were also been studies about intermittent fasting, and that also helps protect against breast cancer, because when you intermittent fast, which can be in different forms, I know some people get afraid of that or think, oh no, I can't not eat or whatever. You're probably doing it anyway, most likely, and you don't realize it, and that's okay. It's just if you're eating from the time you get up to the time you go to bed, that's too much.
Yeah.
I think most people don't do that, but in case you do, we want to limit that. But fasting helps increase the growth hormone, which helps to help stabilize estrogen. It helps remove excess estrogen. But the one thing a really cool thing they found out in a study was that balanced estrogen protects against breast cancer, and it can help it from reoccurring. And they did a study of women who were being treated for breast cancer and also intermittent fasting at the same time. And there was a 70% reduction of reoccurrence of breast cancer. I think that's
a lot.
That's a lot. That's pretty significant. Yeah. So anyway, so those are some easy things you can do, like to focus on. If you get cancer, any kind of cancer, I would say you want to use health, nutrient dense foods along with whatever your doctor's giving you. They work hand in glove together to give you the best outcome, and it's possible. So
lots of fruits and veggies, guys. Lots of fruits and veggies. And the other thing that I would add to that is a vitamin D is another one, and specifically D3. So, and that's good for everyone. But in my research, that's what I found was they had talked about vitamin D3. Yeah. So,
and after reading this book, I feel like I'm eating like that. I eat like this. I eat like I have cancer.
So geez. Yeah. Yeah.
I don't want to get it.
That's good. That's healthy. That's right. Yeah. No one wants to get it. So thanks for joining us this beautiful October day. And if you have breast cancer, go ahead.
Support the Tatas this month.
Yes. Support the Tatas. If you know someone who has breast cancer, please feel free to share this little 7-minute health chat with them, and share it with your friends too. Maybe people don't understand and don't know, especially with the young people, so that they better know. All right, have a great day, and we'll see you next week. Bye-bye.
Bye.